Hi everyone, my name is Anna Martin and I'm here to present the findings of our research titled COVID-19 Assessing the Impact of Lockdown on Recreational Athletes that myself, Dr. Francesca Champ and Dr. Zoe Franklin completed over the summer as part of my master's dissertation at Manchester Metropolitan University. As we are all more than familiar with, the COVID-19 lockdown has resulted in restrictions, including the cancellation of recreational sport. Since the outbreak of the pandemic, international researchers have established changes in activity levels, yet there has been no indication of the effects of lockdown on English activity participation or what people have turned to following the cancellations of their club sessions. Therefore, the aim of our study was to assess the psychosocial impact of COVID-19 restrictions on recreational sports players, investigate what alternative exercise methods have been sought, and also to identify how players are feeling about returning to training following the easement of restrictions. To do this, we proposed 3 research questions which you can see on the screen. We designed an online survey which was live for 6 weeks commencing in May 2020. 1,213 adults whose recreational sport had been cancelled by COVID-19 completed the survey, with the final sample representing those involved in 37 different sports, including athletics, cycling and hockey to name a few. The survey consisted of multiple sections that you can see on the screen. For analysis, participants were grouped into age and resilience classes, with non-parametric tests and percentage analyses being run. Results and conclusions will be discussed together during the next slides. Interestingly, no differences were found between participants who had or hadn't caught COVID-19, or those who are or are not considered vulnerable by government guidelines, suggesting lockdown restrictions impacted individuals equally, regardless of actually contracting the virus. A significantly greater negative impact was seen for females and team sport participants, potentially reflecting their tendencies to participate in sport due to social and affiliation motivations. Winter sport participants were also significantly more impacted, which reflects the timing of the start of lockdown. The 18 to 39s were more negatively impacted than the 2 older groups, with those in lower resilience groups also more negatively affected. This was not surprising considering low resilient copers showed lower perceived social support and high levels of psychological distress, both of which were likely exaggerated by lockdown restrictions. The overall number of exercise days significantly increased during lockdown, which may be explained by increases in leisure time and heightened health awareness messages, plus the allowance of exercise in lockdown restrictions. The sampling of recreational athletes may also have contributed to this, as active individuals are known to increase activity in stressful times in order to cope, and also report high levels of autonomous motivation. The second research question found that the use of online workouts, fitness apps, and home gyms significantly increased during lockdown. Technology was popular as it bridges social distances and prevents social isolation, with the use of apps also replacing the role of coach for many participants, compensating for usual training sessions. It was noted that not all individuals have access to technology, and this may limit home-based activity. Despite engagement with alternative methods, participants deemed them to be less satisfying, less intense, less enjoyable, and claimed to be less motivated to exercise compared to their usual recreational activity, suggesting more extrinsic motivation. Despite this, several participants indicated that they would continue with their alternative methods post-lockdown, suggesting lockdown has been beneficial in exposing recreational athletes to new concepts and alternative ways of exercising. The final research question identified that most players are looking forward to returning to sport. However, players were apprehensive about implementing social distancing, especially in close contact sports. To overcome this, sports clubs should contact participants before reopening to communicate new measures and initiate discussions regarding concerns. Self-doubt and fear of injury were also noted, which should be acknowledged by coaches when designing early training sessions. Age group differences were also evident, with a higher health risk to older players reflected in their concern of catching the virus and younger members' concerns of spreading it. As we continue to be affected by COVID-19 and restrictions placed on recreational sports remain, it's important for clubs to consider how best to support their athletes as we move in and out of local and national lockdowns. Although the impact of COVID restrictions differed between subsamples, engagement with alternative exercise methods was high, and therefore clubs should promote home-based exercise using online and low-technology methods to engage athletes in club training during lockdown. Clubs should also encourage continual discussion with members to reduce concerns of social distancing logistics and highlight the safety of new protocols. Clubs may also find it useful to target additional support to females, teen, young and low resilience athletes, provide additional printed workouts and investigate learning equipment to members as access to kit was highlighted as an issue during lockdown. Thank you for listening and please do get in contact if you have any further questions about this research.